Okay, so today we're going to talk about, kind of the current landscape with kind of cybersecurity in general. We're going to talk about why the importance of the HIPAA security officer is critical, to help combat and maintain your organization's compliance with the HIPAA security rule. We're going to look at some current risks, threats, and vulnerabilities that are definitely, affecting the healthcare space as we know it today. And, things are, kind of not getting any better, so we still have to, keep looking at these things. And then we're going to discuss some different protection strategies. So we will look at, well, what can we do about these risks, threats, and vulnerabilities, besides just knowing that they're out there. What can we do to help prevent them? So first off, let's just take a quick look at the importance of the HIPAA security officer. Essentially all covered entities, they're required by the HIPAA security rule to identify and appoint a HIPAA security officer. And not just in words, you can't just be like, well, this person over here is the HIPAA security officer, but it also should be documented as well to, maybe it's a part of the person's job description, maybe it's, just an appointment letter that says, Brian Friedman is the, the HIPAA security officer for our organization, and just something that, identifies that person, not only, to that person, but to the organization. So part of the responsibility there really comes down into, a lot of these key areas that we're going to look at now. So essentially, one definitely misconception regarding the HIPAA security officer is that, the security rules are IT related. So, you need to be an expert in IT to hold that role. But what you'll find out as you dig into it is that, well, yes, having an understanding of IT is very helpful. A lot of this is, being the security officer is a matter of coordinating and working with other teams. So maybe if you're not in IT and you're the HIPAA security officer, you have the right contacts within your IT group, whether that's, in-house or maybe it's an outside consulting company. But you have the resources that you could reach out to make sure your organization's in compliance. So one of the primary responsibilities with the HIPAA security officer is the development and implementation of policies and procedures that are there to ensure the confidentiality, integrity, or availability, so a lot of you have heard of that as CIA in the past, of electronic protected health information, or EPHI. The security officer is also charged with creating a security awareness training program, and that training program should be not something that's sort of on autopilot. You want to, while you definitely want to do it annually, you want to make sure all new employees go through that training within a very quick time period. So if your organization has an orientation program, that's a great place to inject that if it's not already being done there. Auditing. So again, you may not be the person doing the auditing or getting the logs or getting that information, but you're responsible for if there is a breach reported, or you're trying to figure out what's going on, that you would be responsible for auditing that information and working with those appropriate people to get those audit records, logs, that kind of thing, to help pinpoint, well, was it an incident, was it not an incident? Which brings us into then, that incident management breach investigation. So, you'll be looking at auditing, you'll be, maybe interviewing or talking with maybe managers or other people to figure out, well, is this actually a breach? Is it not a breach? How many people are affected? Is it, under 500? So we have a year to report it, or is it, is it like, thousands of people? Well, okay, we need to report this, immediately, up the chain. The security officer also oversees business associate compliance. So again, what I always recommend here is that, your role as the HIPAA security officer, you should be aware with who your organization is doing business with, and particularly who your business is sharing electronic protected health information with. So are you giving out your data for research, or however that data is being shared is maybe your electronic health record system outsourced, so, or your patient portals outsourced. So data flows to those systems. So, it's important to understand who you're actually doing business with, and then making sure that you're sort of monitoring what those organizations are doing. So I always say you really need to vet your business associates, and be a part of that process, not just be like, okay, well, we want to do business with, company B, let's have them sign this and move forward. It's more than just signing the business associate agreement. It's making sure that, they're following that and making sure that they are, in compliance as well. Another kind of a major function of the HIPAA security officer is performing risk assessments covering the security rules, technical, physical, and administrative safeguards. So again, I do a whole separate presentation where we kind of dive into a methodology for doing a risk assessment. But essentially, this is really an ongoing kind of thing. It's not like, oh, we did a risk assessment once and we're good to go. You do the risk assessment, and then that's a continual process. Again, it needs to be documented. If OCR was to come in and audit, you want to be able to quickly show them, yes, here's the results of my last risk assessment, here's our project plan of the items we're working on, because they're not expecting people to do a risk assessment and say, okay, well, wow, we got like these 20 things to fix and we're going to fix them in 2 months. But if you show a plan that says, hey, over this 2-year period, we're going to, we're knocking out these things, these are our deadlines, maybe we have to hire people, maybe we have to buy software, so that all could be, if it's documented, at least it's shown that it's being taken seriously and you are actually kind of continually evaluating the risk within your organization. And then in some cases, the HIPAA security officer might be the HIPAA privacy officer, so that makes things easier in those cases. But if not, it's critical that you're kind of working side by side with your organization's HIPAA privacy officer, as they're dealing with privacy rules and regulations and that kind of stuff. So it's important to understand where, kind of your jobs maybe cross or intersect, and definitely work together with that person. So, like I like to use this slide here, so what's the security officer actually protecting? I mean, if we just look at these graphics, you got mobile devices, you have, emails, you have, websites, all sorts of things. I mean, everything, digital information. I mean, the list goes on and on and on, and all of these different things are targets for risks and vulnerabilities, and the bad guys want to get a hold of this stuff. So it's important that you understand what you're actually protecting. Understanding where your data is, again, where your data is flowing to, or maybe where your data is flowing from. So maybe you're in a position where you're the business associate to a bigger company, or not necessarily even bigger, but another healthcare company where you're providing them services. Well, again, you should have as a HIPAA security officer for that business associate, you would then, again, will want to know, well, where's all the data we're taking in from all these people, and if we were to have a breach here, who are we going to have to notify? What organizations? Is it, if it's a cloud-based type resource, maybe all your customers' data is all kind of, sort of in one area, and if that area was to be breached, then now you have an issue of, well, now you're contacting all the companies. Maybe it's more segregated, so maybe now you say, okay, well, this segment of our application, was breached. Okay, that affects, these 3 customers instead of, all 30. And so, again, you have to know who to contact and where to go. So to keep in mind, though, that, not only do we have the data to worry about, but we also have to worry about the physical parts of this. So, the HIPAA security rule does talk about administrative, physical, and technical administrative controls. With that being said, so where is the data physically? Is it in a data center that's locked? Is it at a, is it in just an office? Where is that, and what are you doing to make sure that physically somebody can't just walk into the office and pick up the server that is your, housing your electronic medical record system and just walk out with the whole thing. So, there's some things there that need to be taken into account as well. So I kind of briefly mentioned the CIA, or the confidentiality, integrity, and availability triad. And looking here, when we're talking about what are we protecting, so if you notice, none of these triangles are, confidentiality is not bigger than integrity, availability is not larger than confidentiality. Each triangle kind of in the bigger pyramid here are central building blocks, and those blocks are equal in size for a reason. So basically because one isn't more important than the other. So when we look at confidentiality, we're looking at how are we keeping that information secure, confidential, private, so it's not just leaked out onto the internet. What sort of things are you putting in place to make sure that when a user logs into the system, they're only seeing their data. They're not seeing data for all the patients in the system. So those are some examples. Integrity. Integrity is important, especially in healthcare, because with integrity, you're talking about, the data I'm protecting, can I trust it? Is it valid? Is it accurate? So, imagine if a patient's, medical record said he had type 2 diabetes, he had, other diseases, and he actually didn't. So when, the doctor, the provider's seeing that patient, and he's looking at the chart, and the chart's wrong, because the data integrity was compromised, that could, wrong prescriptions could be prescribed, all kinds of different things could happen. So you have to, rely that that data is kind of left intact and not modified or changed. And then availability, I think, is kind of one of the easier things to understand. So funny enough, where I live off the South Carolina coast, so we actually have a hurricane kind of coming towards our way as I speak here. And so, what's the organization going to do? How am I going to make sure that my systems are stay up and running during a disaster or after that disaster? What kind of contingencies plans, disaster recovery plans do I have in place that are going to make sure that, I could pick back up, Monday morning and continue to, see patients, or maybe even during the storm, if you're in a hospital, that kind of a thing. I mean, that, a lot of they don't close, right? So how are you going to make sure your systems stay online and that data is available, to treat patients or provide the services that you provide? And lastly, with the CIA triad, what you'll see here is that they're all kind of surrounding information security. So really, information security is the heart of the CIA triad. And, by having sort of this balancing act of, confidentiality, integrity, and availability, by maintaining those things, you're actually maintaining information security against your assets and your organization. So now we're going to take a look into some current risks, threats, and vulnerabilities, and just kind of talk about how they affect healthcare, and we'll take a look at them. So some of these, we're going to go into detail on all these. We're going to look at some examples. But what I always like to kind of first discuss is the concept of basically how, you have your assets. So you have your computer systems, you have people, you have your buildings, you have threats to those assets, you have vulnerabilities to those assets as well. So if you kind of look at the diagram here, you'll notice there's this intersection in the middle, and there's an arrow pointing, it says risk. So, basically, again, these things now, what you'll find differently than the CIA triad is that, depending on the asset, it might have, there could be more vulnerabilities, there could be bigger threats. So even though this looks like it's a, perfect little triangle in here where this intersects, it's gonna fluctuate, and that's really where your risk assessment comes in to figure out, how much risk can we tolerate if the system went down or was to go away, or how much fines can we handle if our data was compromised and posted out on the internet. So it's more of a, you have to evaluate, the risk for your organization, because one of the things you always have to consider is that, if I'm a small, independent physician provider clinic or office, with 2 providers, we see patients, there's, we don't have, we're not have a big hospital system behind us, that kind of a thing. What you'll find out is, well, if they get fined $1 million, are they going to be able to stay in business? Well, you'll see, and you see in some of these examples, when OCR with some of these bigger organizations, well, $1 million might be like a, might be change for some of these organizations, and they're like, well, yeah, well, so those thresholds have to be looked at when you're looking at the threats and vulnerabilities, and that risk, because every organization, big or small, is the threshold is going to be different for them. So let's go ahead and we'll jump in and start to take a look at some of these current threats and vulnerabilities and risks that we have going on in healthcare today. So first off, this is one that came out earlier in the year, in 2018. So we had Spectre and Meltdown. And the reason I like to bring this one up, it had a lot of press early in the year, and as the year's gone on, definitely you could say, well, this really hasn't been that big of a deal, or maybe it wasn't as big of a deal as they made it out to be. But one of the key things you need to consider here is that Spectre and Meltdown affected, or it actually still affects, all modern computer systems within the past 20 years, based on the, basically what they call microcode within inside the CPU, so the chip or the processor within every computer, it had this flaw basically in it, kind of sitting there sort of unknown. So one of the problems with this is that, sensitive data can be viewed on unpatched systems, and really, so there's a couple things about this that I always like to point out, is that one, so if you didn't have physical access to the system, or that would make it a little bit harder. But that's where the biggest threat really came in these cloud or virtual environments. So now you have one piece of hardware, might have a bunch of CPUs with this vulnerability, but now if you're sitting on one virtual machine, you might be able to see the data traffic flow coming off another virtual machine. That could be a whole different customer, could be separate from your organization, or vice versa. Somebody could be looking at your stuff, kind of a thing. But the biggest problem that this caused wasn't the actual vulnerability itself. I think that what ended up happening was, because there was a big push to remediate these vulnerabilities in a timely fashion, because as time went on, they'd realized how more and more computers and systems were affected by it. Well, also Microsoft started releasing patches. Well, Microsoft released patches and had to pull back those security patches multiple times. In one instance, for example, if you used like Symantec or Norton antivirus as the antivirus on your systems, well, then if you pushed up these Microsoft patches, when you rebooted your computer, the computer, they were just blue screen. So you basically inevitably, disabled your computer. So Microsoft pulled those back, and then by doing so, then Symantec had to release patches, and then it was like, make sure you apply these before you apply those, and it was a whole kind of thing. And so I think what's important in understanding a vulnerability like this is that, you need to kind of carefully plan these deployments. So, hopefully at a minimum, you can have at least a test desktop, laptop, and server. Even if you only had one of each, you could then say, okay, what would happen if we apply these patches to it? Oh, well, it breaks the machine. Well, that's better finding out that it broke your test machine before you found out it broke, all 500 of the computers across your organization, which would basically cripple. That's where we get. Now we're talking about availability, sort of self-inflicted. Now no one can access data, do their job, that kind of a thing, until these machines maybe, in some cases, were sort of reformatted and kind of set up from scratch again. The other, I think, real big potential with something like Spectre and Meltdown, and maybe we'll still see this, is that it's really not it's sort of when will more serious exploits be created. If you notice, over the years, one of the things that happens is that these kind of bad actors, they're saying, well, this vulnerability affects every computer in the past 20 years. Well, hey, we should maybe focus our efforts in writing malicious code, viruses, that kind of stuff that could play off of this. And so, they look at these bigger targets, right? Because bigger targets typically means for them more money, more destruction, that kind of a thing. And I think you'll see that with that, I think a great example was, it used to be that, you would, like Apple products, people would say, oh, you don't need to run antivirus on Apple, and the Macs are secure, and they were a lot less of a target. But over the years, with the iPhone and the Apple Watch and the Mac, Macintosh OS as general, you'll notice that Apple releases security vulnerability patching every month, just like Microsoft does now. Sometimes even more frequently. So depending on what's going on. So I think that, again, as those kind of platforms have developed and kind of taken on popularity, the hackers are saying, hey, we're looking at that because we could do more damage, affect more people, make more of whatever they're trying to do. So let's look at ransomware now. So really what ransomware is, and this is another one of those things, it seems to it's kind of like ebb and flows. You hear a lot about it. You don't seem like you hear about it for a couple months. A new variant comes out, you hear about it all over again. But generally it works in a similar way. There's, again, these different variants will work different ways, but inevitably it will kind of act as a virus or worm, and that it's essentially malicious software that will encrypt your computer files, your electronic protected health information, or really any data that's on the system at all. The software itself will demand payment through some sort of cryptocurrency, so like Bitcoin, to get access back to the file. So the only thing you'll see on the computer screen is a message that says, transfer X amount of Bitcoin, to this Bitcoin address out on the internet. And once we receive your payment, we'll basically unencrypt and release your files. So you have to sit back and wonder, well, do you pay? Do you not pay? And so different organizations, if you look throughout the course of even in the past year, some choose to pay. Some do get their data back that way. Some decide not to pay, and they just say, we're going to deal with this based on our own kind of system recovery procedures, and we're going to deal with this as a virus. In some cases, organizations have paid, and then the stuff's still locked and secured. So, and there's also, I think, definitely a fear of, in today's times, of kind of like the social media aspect of this, whether it's television, news reports, Facebook, all these different places. If when an organization gets hit with a ransomware attack, and if it like shuts down a hospital while this is being investigated or whatever, it makes people kind of nervous and wonder, is this somebody I should be doing business with? And it's something you need to consider. But really, one of the things you need to do is look at, how can we actually prevent this altogether? Really, one of the simplest ways would be to just make sure you have good backups of your data. If your data gets encrypted by ransomware, while it might take several days, and then maybe to recover that data, at that point you could say, well, you know what, we don't need to pay them because we have our data. We just don't have it live on our systems. So we'll basically stop it on on these different machines, and we'll rebuild, and we'll kind of just move forward. There's also other types of programs out there, kind of like antivirus programs, that will allow you to kind of look for ransomware. So they'll look for these processes that kind of appear on the computer and run, and will, inevitably, if it sees something that's like ransomware-like, it will block them. So, maybe it's a matter of, not only having good backups, but investing in some, and a lot of this is like machine learning type software, where it kind of knows what the user's doing kind of on a day-to-day basis, and then when all of a sudden this weird process happens and files start getting encrypted, it's able to look at it and say, whoa, wait a second, that's not good, block it and stop it. So there are different ways to deal with ransomware, again, without having to pay, and there's always that risk. So let's take a look at a real-world ransomware example. So in January of 2018, so earlier this year, Hancock Health, which is a health system based in Greenfield, Indiana, they had the SamSam ransomware attack. It accessed computers through an outside vendor's account. So one of their business associates' username and password became compromised, and the bad actors were then able to use that to inject this SamSam ransomware attack on the computers. So it locked out data, and it changed names of more than 1,400 files to just, I'm sorry. So they sat back and they looked at the damage and how long it was going to take for them to be back up operational. They also looked at some of their own backup and recovery strategies and what data did they have access to or didn't have access to. They paid a ransom of over $50,000 US dollars, in Bitcoin, to have their data unlocked. So they were lucky, though, really, when the data was unlocked after the transfer of the money. They claim that no patient data was compromised. I have to sit back and wonder, because if sometimes the ransomware will not only encrypt the data, but it will also copy the data somewhere else. So it could have uploaded it somewhere or that kind of a thing. So in their investigation, though, they determined that patient data, while it was encrypted, it wasn't leaked or breached or compromised in any fashion. The other thing to consider that they did, is that the FBI actually has is really their computer crime task force is really actively involved in helping to prevent these ransomware attacks. And one of the things you could do is if you contact your local, every state has a FBI cybersecurity office somewhere in your state, and if you contact that office and you say, hey, we were a victim of a ransomware attack, this is what's going on, these are the messages we're getting, a lot of times they actually, because they've been involved in helping others remediate these issues, they might actually have the keys to unlock, to unencrypt all the data without having to go pay for them. So by contacting them first, you're getting them involved, and again, you could save a lot of money potentially, and maybe very quickly be back and running. And and they'll also help guide you through the right or the wrong to do with this. Or sometimes people are like, I don't even know how I would transfer $50,000 in Bitcoin to somebody, even if we wanted to pay. So again, there's, would be working with them to determine sort of the best course of action, because inevitably they want to try to catch these bad guys as well. Because when whoever did this, when they get paid $50,000, they're moving on to their next target immediately. So it's just a matter of time before more and more organizations are affected by ransomware. So social engineering, it's another kind of way that data is kind of leaked or can be leaked from your organization. It really just takes advantage of human behavior to pull off like a scam. So we look at the little graphic here. It's like, well, the person's like maybe a help desk call center worker, and here we have the bad actor on the cell phone. Hi, Amy, this is Joe from IT. I'm working from home today. Maybe the conversation continues down the line of that, I need my password reset. And they work, you kind of work with them to get your password reset. So, but there's many different types of social engineering that you need to be aware of. So, one, electronic. So we have email, social media, websites, passwords. Could be ways. So, example of electronic could be like a phishing email where the bad actors will send emails in your organization saying like, hey, if you don't, you need to change your username and password today. What inevitably happens is people click on it, they think, oh, I need to change it, so they're prompted to give their current credentials. They put their current credentials in. Well, now these bad actors have, logins to your systems, potentially, because now they have usernames and passwords. Some other, and that's when they're directly kind of targeting your organization. Sometimes called spear phishing. But there's also this thing, other types of phishing might be, you get an email that it looks like it's from PayPal or Microsoft or somebody, and it looks really good, and inevitably they're trying to harvest that information so then they can take it and use it. And what we're finding is one of the biggest threats with phishing today is that real email accounts are getting compromised. So I've worked with several organizations where this has happened, where they get, they're getting email from people they do business with, and they're like, well, yeah, I work with Sue all the time at, company ABC. She's asking me to do something that a little seems out of the ordinary, but not really. So yeah, let me reply back to this email with the information she needs, or whatever. And it turns out that, well, Sue's account got compromised, and this person went through that person's contact list and looked at other emails and said, okay, well, based on the kind of conversations that Sue's been having with these other people, I'm going to kind of use that to my advantage to sort of trick these people into maybe sending me, paying invoices or that kind of thing that, wiring money, all sorts of different things, could take place. But again, it makes it difficult because you're like, hey, I see a real email. It's like from a real person. It's not just some crazy thing. So it's just important to kind of look at those and evaluate, every email that comes in when they're asking for information. So physical social engineering, it's essentially gaining access to where they should not have access to. Sometimes you'll have, bad actor, a little bit more risky, right? Because electronic, they could kind of work kind of anonymously and in the background. But physical, might mean that they're trying to get a hold of some specific information. They know, hey, this information's stored here. Maybe it's kind of, it's sort of inadvertent. You have somebody who's maybe an insider who's they see what's going on. They see, day after day, there's protected health information that's kind of just left out on people's desks, and they say, well, if I can get access into this area, then I know I could, like, especially after hours, I could get that information. I could go out and sell it on the internet, and off we go, kind of a thing. And then probably again that another bigger target is again, because it works anonymously, is phone social engineering, or sometimes they call it phishing or voice social engineering. So basically, can the people you have answering the phone be tricked? I work with organizations that have, they have call centers, contact centers, both for IT, for patient care. What sort of procedures do those people have to kind of authenticate who's calling in? Because you can't say, let me see your driver's license. You can't say, do this. So there are some different methods that can be employed in those areas. In some cases, now there can be systems put in place where, if you want to authenticate the person, you could require them to have a mobile phone number on file. And when they call in, you say, and a lot of actually credit card companies and banks and credit unions have started to do this recently. But you could, when they call in, they say, hi, my name's Brian, and they'll say, okay, well, we need you to verify your phone number. And you say, okay, well, the number I've put on file is 843-555-1212. They look and it goes, okay, well, that matches. Okay, we're going to now send you a text message to that number, and tell us what the code is. So with that, now they've kind of authenticated them. They have the phone. It's much more secure than just kind of saying, like, answer these following questions, like, where were you married? Where were you born? What's your mother's maiden name? All these questions, while they're definitely useful, a lot of the questions are like just information that people just get out there on the internet. So it's amazing at what some of these people, when they're trying to get information, they might call other places to find out, like, names. They could call your vet to find out, like, the names of your pets. They might call into your organization, well, what kind of questions are they asking? And let me go see if I could find out, what these answers are. And I'll call back, I'll get somebody else on the phone, I'll have the answers, I can give them the answers, and off we go. So let's take a look at an example of phishing. So this is, again, this is a, based on here, this is kind of a good message. Here's a message from, looks like it's from Anthem Blue Cross Blue Shield. So after Anthem actually had a breach of information, people then used that information to their advantage and said, hey, I'm going to start sending out emails to people saying, like, hey, we want to make you aware that you might have been affected, that your personal health information and credit card data. Same thing, we had the big Equifax data breach. Within days, messages were going out that looked like they were from Equifax, telling people, hey, we need you to do X, Y, Z. Because they were gathering this information, they were trying to get, kind of using people sort of like while their guards down, saying, well, yeah, I heard about this breach, and yeah, I use Anthem, or yeah, I use, well, everyone uses Equifax. So, they kind of take advantage of those situations. So a lot of times, again, they're looking for things like username and passwords. They might be looking for credit card details, access to your accounts, and that kind of a thing. So a real-world social engineering phishing kind of incident was in November of 2017, so last year. It's basically the state of Florida Agency for Healthcare Administration. They had 30,000 people on state Medicaid had personal data compromised. Some of that data that was compromised, things like full names, their Medicaid ID number, dates of birth, addresses, diagnoses, medical conditions, and even Social Security numbers. Basically, the breach was caused by a single employee clicking through a phishing email. They got the email, just one person, they clicked through. They were then able to get into the systems and get access to that, the 30,000 people's information. So, again, what you need to be doing is constantly training your employees about how to, look at these phishing emails, how to determine what they are, and then, get them into a habit of, like, instead of just like acting on them, report them to IT. And let IT maybe take a deeper look at it. So insider threats. So according to the U.S. Computer Emergency Readiness Team, or U.S. CERT, basically an insider threat is, it's an individual who has authorized access, so it's one of your employees. The access they can use to, maliciously or sometimes even unintentionally act in a way that can negatively affect the organization. So when we look at some of these insider threats, it could be malicious. You could have a disgruntled employee. They might have determined, hey, I'm going to, if I do this, maybe they were contacted by somebody on the outside saying, hey, we're looking for 20,000 records. We'll pay you, $50 a record once you hand them over to us. So then it becomes, malicious. Again, this is an employee. So somebody on the inside, maybe it's a vendor even. So it could be a business associate. Accidental, just that. Maybe the person, they didn't really, realize that they were, that they basically, let's say, printed out a bunch of information and just threw it in the trash without thinking, or, they, essentially they, released, maybe inadvertently, accidentally released that information. Personally, what happened to me, which I'd consider accidental, was I changed the beneficiary on a life insurance policy I have, and the person who basically sent out the confirmation form saying, okay, hey, we've updated your beneficiary to this, well, they sent it to the wrong person. So instead of sending it to me, they sent it to somebody else. And on it, it had, my information, it had my beneficiary's information, had our Social Security numbers. So again, it wasn't intentional, it was accidental, but then they inevitably did right by me, I guess, and provided me credit protection and that kind of stuff, and, told me how they, kind of retrieve the information back, and they knew who they sent it to, that kind of a thing. And then there's also just, non-malicious, so there's no real intent to harm the organization, but, again, through some act, whether accidentally or not accidentally, there's a threat that is occurred. So let's look at a real-world insider threat. In February 2017, the Memorial Healthcare System, Office of Civil Rights had a settlement with them for $5.5 million. Memorial Healthcare System is a Hollywood, Florida-based healthcare system. So unauthorized employees had access protected health information of 115,143 individuals, and disclosed it to an affiliated physician's office staff by using legitimate credentials. So information included patient names, Social Security numbers, and dates of birth. They had policies around access, but they weren't actually implemented correctly. They didn't actually regularly review records of system activity, so they didn't know. Remember, we talked about very early on in this presentation, we talked about auditing and knowing who's looking at what and that kind of thing. So they weren't looking at who was actually had access to stuff that they shouldn't have access to. But this was kind of, so inevitably they, they received a pretty hefty fine. So really, one of the interesting kind of takes on things, and the healthcare things, are medical devices. So there's all kinds of different medical devices used. It's really it's a new target for cyber criminals. The medical devices, they're just as vulnerable to breaches, because a lot of times they're running, they might be running Windows 10 on them, or they might have software on them, and could have, basically temporarily storing protected health information of an individual. The FDA is taking an active role in securing medical devices, and so really what their advice is that you really need to start evaluating the security during the acquisition process. So when you're looking to get a new CT scanner or a new modality, or you're looking to incorporate some kind of new medical device for treatment, maybe it's a medical device that patients would actually use, that you're going to be prescribing or implementing, you would need to look at that evaluation during that process. So so we have a real world case of medical device vulnerability, essentially. So Abbott's, which was formerly St. Jude Medical, in August 2017, the FDA recalled 465,000 implantable cardiac pacemakers after discovering security flaws. So essentially, people have pacemakers. They discovered that because of the way the pacemaker is able to transmit information and receive information, it could allow an attacker to actually reprogram the device to run the batteries down, to actually modify the patient's heartbeat. So essentially, the pacemakers, they use this Merlin at-home transmitter. So when the patient's at home, maybe it's like by their bed, it basically connects to it and uploads information to the doctor. So that way the doctor can remotely like look at all their patients and say, okay, well, this person's heartbeat's irregular, we need to get them in. So it's actually a very great technology, but when it was being implemented, it wasn't these flaws weren't discovered. So essentially, a firmware update was required to fix the vulnerability. So again, thankfully, the people didn't have to go through our open heart surgery again. They were able to use this kind of same technology to wirelessly update the firmware or the software on the pacemaker itself to repair those vulnerabilities. But if you think about it, that's just one type of device that's out there that, in this case, almost affected like 500,000 people. So some protection strategies. So we talked about what the HIPAA security officer, his kind of roles and responsibilities are. We looked at all these different threats and vulnerabilities and risks that you need to be worried about. But okay, so in some cases I talked, as we talked through, like, well, these are some things you could do or should do when you're trying to prevent these risks, threats, and vulnerabilities. But really, your key element is that risk assessment. It's sitting down, figuring out, where your PHI is, where your offices are. Just figure out the level of risk within your organization. And again, there's several different ways to do this. The HIPAA security rule itself isn't very prescriptive on how to do a risk assessment, but there are several, very well-known, used now methodologies that could help. Vulnerability management, so things like antivirus software, some of that machine learning, process monitoring type stuff. Looking at your systems, are they patched? Are they up to date? So having a vulnerability management program in place where you can honestly look out and say, out of our 500 machines, we have X amount of machines that aren't patched and up to date. Maybe their antivirus is not up to date. So by going through that process, you could kind of secure, the sort of the perimeter of, so you're securing all your computers where a lot of these things might come in. So encryption. Encryption is another great way to, now this is kind of good encryption, not the bad encryption of ransomware, but is your data encrypted at rest? Is it encrypted in transit? So those are two key things that are always brought up. We have incident response. So again, what do you do when you have that incident? Your disaster recovery, business continuity planning, your tabletop exercises. So now you have a disaster recovery or business continuity plan in place. You're actually exercising it. Are you sitting down all in a room together and kind of enacting it? Declare a disaster. Hey, we have a hurricane. It just hit us. We're all down. What do we do? So do it on paper. Sit around and talk about what you do. Go through the process of maybe not failing over your system, but what would you actually do to bring that up and get that back working again? So again, looking at more detail at some of these, we have with risk assessment. So again, there's no single method that guarantees compliance with the HIPAA security rule, but most should have, similar steps. So you should have, this is kind of one high level, like one methodology that could be used. Identify the scope of the analysis. So what are you actually doing a risk assessment on? Gather data about that. Identify, document, protect potential threats and vulnerabilities. Look at what current security measures you already have in place. Okay, well, we have a firewall in place that protects our network from anyone just connecting to it from the outside. So maybe that now lessens that risk because you already have a security measure in place that kind of helps mitigate that. You need to determine the likelihood and the potential impact of the threat occurrence. So when you're looking at likelihood, you could say, well, is a UFO going to land and take over the planet? Well, that's probably pretty low. But I live in coastal South Carolina, so the likelihood of a hurricane hitting us is actually fairly great. And there's every year at least there's there's a threat of that happening. So what is the potential impact? And all these can be rated at high, medium, and low. So what's the impact? Well, if I get hit by the hurricane and all my systems are down or damaged or my buildings are destroyed, that's going to be a pretty high impact. But I might have, other things where the threats are lower, or maybe because I've put things in place, I, have my backups or I have a whole secondary system that can run out of a data center like in another state, that kind of a thing. So then once you determine the level of risk based on the likelihood and potential impact, you then identify the security measures and finalize your documentation. So just meaning, what are you going to do to fix these things? What, are you going to put in systems, software, people? And again, it's something that as long as you document it and you have a project plan of how you're going to roll these security measures out, that's really what OCR is looking for when they come in, and then you're constantly updating that. And then as new kind of things come in, you maybe have mini risk assessments. So you're like, oh, we're going to bring in this new modality. Let's do a risk assessment on what we think, how protected health information might be affected by the use of this device. You also have to, one of the requirements of the HIPAA security rule is to develop a risk management plan. So you develop and implement a risk management plan, and that plan is basically telling you, sort of outlining what we just talked about. This is how we're going to manage our risk. We're going to annually do a risk assessment. We're going to create this project plan. We're going to implement security measures. We're going to keep evaluating, maintaining those security measures. So you kind of talk about how you're going to manage risk within your organization. Vulnerability management. So, it helps to identify those vulnerabilities and the potential risks to your computer systems. Patch management is a term, for workstations and servers. You could use a vulnerability scanner to help identify the level and depth of risks on the network. So there's many made by a company called Tenable, Rapid7, Qualys. So there's a lot of tools out there that you could get your hands on that would help do this. You could even get an external consultant to come in to help do a vulnerability kind of assessment and figure out, like, where do you lie today? So, and again, you can do both internal, like you could bring a third party and say, well, let's look at all the computers inside of our organization, our workstation servers. But let's, you also want to consider doing an external network assessment, because those are the assets that are, like, let's say you have a patient portal that's, just internet facing that anyone in the world can access. So, knowing what risks, threats, and vulnerabilities might be affected there, you can kind of stay ahead of the game. So encryption, so I always like to point out that the security rule says it's addressable. Well, addressable doesn't mean that you don't have to do it. It means that you have to address why you're not doing it if you're not doing it. So, and answers, what we've seen, especially in the past couple of years, answers like it's too hard or it's too expensive don't really qualify as valid answers. At some point, if there's a cost of doing business, there's a cost of working with protected health information, and doing so requires that you do these things. So if so OCR stance is, well, if you can't afford to do these things, well, you shouldn't really be in business where you're hosting this data or housing this data, that kind of a thing. So you have data at rest, so how the data is stored on the servers, workstations, data in transit, so people are accessing your patient portal. Is it using HTTPS? Email, if it has, email is going to have sensitive, kind of protected health information in it. Is it being encrypted when it's being sent out to end users, or is it just going out in the clear? Your websites, removable devices, so USB devices, if they're, hopefully you have a program in place where if those are allowed, that they're required to be encrypted. That way, if that USB device gets lost or stolen, you could basically say, it's kind of the same thing goes with a laptop. If a laptop is to get lost or stolen, if you're able to prove that it's encrypted, it becomes a safe harbor, and you could say, well, here's our records and our systems that shows how these devices were encrypted. Therefore, this isn't considered a breach of information because people wouldn't be able to get the information off the system. So that's one of the reasons why encryption is important. Incident response. So are you prepared for the unexpected? So the HIPAA security rule defines a security incident as, an attempted or successful unauthorized access, use, disclosure, modification, or destruction of information or interference with system operations in an information system. So kind of some high-level incident response steps. You're going to prepare. You're going to, be in a mode where you're kind of doing detection, analysis. You're kind of looking to be able to discover these incidents. And then once you've discovered that you've had an incident, how are you going to contain it, get rid of it, eradicate it? How are you going to recover from it? So then you have to also consider, based on an incident, is it a security incident, or was it a breach of protected health information? And if so, is it under 500, so you have time to report it? If it's over 500, so looking at the breach notification rule, you could say, well, based on those numbers, these are the next steps we're going to have to take to report this information up to the federal government. Disaster recovery, business continuity, kind of understanding the differences. So a disaster recovery plan, it's concerned with restoring normal business operations after disaster takes place. So when a hurricane hits my business and we're destroyed, how are we going to get everything back up and running and keep going? From a business continuity planning perspective, how are we going to, keep business operations running after disaster has occurred? So, your normal business operations might be, well, how are you going to see patients? Maybe you go into paper charts or something in the interim if your EHR goes down. But how do you actually keep your business running? So how do you keep all your back office stuff going? Do you're able to still do billing and that kind of stuff? So and in the HIPAA DRP, or Disaster Recovery Plan, it's really the document that specifies the resources, actions, personnel, and data required to protect and reinstate healthcare information in the event of a disaster or system failure. So the HIPAA DRP is really all about getting access back to that, back to that data so that the providers can continue to do work and do that. So a tabletop exercise really is, so a lot of times you've created these plans, but then they're never tested. A disaster happens and you go to use them and you find out you're missing steps. Things aren't working right or not as expected, or, oh, you didn't think that you needed to back up this system because it was a system that had data that you were going to need. So these tabletop exercises, it's a simulated real-world situation, led by a facilitator, where you can interact to events as they unfold in a classroom-type setting. So typically, the participants represent key areas that would be affected by an incident and provides a way to test, the incident response plan, DRP, or BCP plans. Really, the goal of the tabletop exercise, though, is to increase the security situational awareness and facilitate discussion of incident response in as simple as a manner as possible. So you're not failing your systems over and saying, can we run off our backup system, but you're together walking through a disaster or a ransomware attack, and using your plans. Do they actually work, and are they going to, in case you needed to use them, are they going to be effective? This slide here shows you some free tools that are out there on the internet to help you with your efforts. I have some screenshots of these. But the Health and Human Services Office of National Coordinator has the Security Risk Assessment tool. NIST has an older tool that could be used for HIPAA security rule, kind of like a questionnaire. It's still a decent tool, though. And then US CERT actually has the Cyber Resilience Review Program, and we'll kind of take a look at all three of these here in a second. So the ONC, Health and Human Services Security Risk Assessment Tool, it's an application you download. It kind of walks you through, so things to consider, threats and vulnerabilities, examples of some safeguards. But you go through and you answer these questions. So like, do you take steps necessary to implement your facility security plan? Yes, no. Well, if no, you could document here what the current activities you're doing, what the remediation might be, and you could also sit there and figure out, what's the likelihood, low, medium, high, or the impact. So you're kind of using this tool as a way to kind of do a guided risk assessment. And of course, if the Office of Civil Rights was coming to audit you and you said, hey, I'm using the Security Risk Assessment tool to do our risk assessments, manage our risk assessments, and they probably would have a very hard time, disputing the, what you've used to do the risk assessment. The NIST Security Rule Toolkit, again, is another tool. If you kind of look at the left, it kind of goes through each of the safeguards, so administrative, physical, and technical, and it just kind of asks you questions. And, has your organization, developed, reviewed, updated, trained on your risk assessment policies and procedures? If yes, go ahead and attach the evidence there. So again, it helps you kind of gather everything, again, in one kind of package, and that way, if you were to be audited, you could say, well, here, we have it all in the system here. Here's what we're working on. Here's what we already have. Here's the evidence already attached to these questions. So the US CERT Cyber Resilience Review, it's not directly mapped to HIPAA, but it's mapped to the NIST Cybersecurity Framework. They do have two options. They have a self-assessment, so you can go download. This is just like one screen of showing you vulnerability management. And they actually have some facilitated sessions, so you could contact them. And at one point, it was still no charge. They'll come into your organization and work with you and help you go through this whole process. But again, you could I always say, just use this as a way to kind of figure out, well, where does your organization lie? Is it things you're going to need to work on, improve? It kind of gives you a good baseline. So looking here at the vulnerability management, you know, it's asking you what kind of things have you developed, what tools you're using, you know, are you using them? And then again, you could kind of take the results of all this and kind of look and say, okay, well, these are some areas where we need to improve the security, the information security, you know, of our organization. So at this point, you know, I thank you for your time, and we're going to turn it back over to Vicki for some questions.
Thank you for the wonderful